Hey everyone, welcome to Your Medicare Matters because you matter. And I'm Sandra Ford, Senior Compliance Officer with Trusted Senior Specialist. So today we're going to talk about Medicare's enrollment periods. And you know what? There are a lot of them. Now, most of us really only hear about two of them, right? Really just two. One, when you become eligible for Medicare, which is either when you're turning 65 or if you are working and you have a group health plan and then you're going to leave that group health plan and move on to Medicare, and that is called IEP. But the other big one we always hear about is the AEP, the annual election period. So what I'm going to do is I'm going to turn it around a little bit. So we're going to talk about Medicare's many enrollment periods, but what I'm going to do is I'm going to take it from the beginning of the year, or at least I'm going to try to, and carry it throughout the year in a chronological order, okay? So let me start with the one out of chronological order, which is when you are first eligible for Medicare. And then we're going to go in chronological order. So when you are first eligible for Medicare, that is called IEP, your initial election period. We sometimes see it as initial election coverage period. IEP. Well, this is either one, you turn 65 and you're now eligible for Medicare. Two, you're working and you had a group health plan that was creditable coverage, and you're going to leave that group plan, or you're going to retire and that group plan is going to end, and you're going to decide that I'm going to go on to Medicare now. Or maybe you have disability and you hit that 25th month. That's your IEP. During the IEP, that's your next initial election period, that's when you're going to apply for Medicare A and you're going to apply for Medicare B. Now, if you're in a group health plan and you just choose A, I'm not talking about that. These are folks who are going to get both parts of original Medicare, Medicare A and Medicare Part B. During that time, you're going to choose what kind of other coverage you want. Do you want a Medicare Advantage plan? And what that does is it pays for your Medicare Part A and B services, and they have additional benefits. Most plans will carry vision. They might carry dental coverage, whether it be preventive or comprehensive, transportation, things like that. You can choose that plan. You can stay on original Medicare. That's not something that I ever would recommend. Why? Because whenever you have original Medicare, and you'll see this in our other videos, you are responsible for 20%. So make sure you tune in one of our other videos. But during that initial election period, you're going to get your Medicare A, your Medicare B, and then if you stay on original Medicare, you need a prescription drug plan. So it's going to be a Part D plan. Now, if you choose a Medicare Advantage plan, it will come with the Part D. But let's say you choose a Medicare supplement, and that's where I really want to talk to you about is that Medicare supplement plan. When you get in a Medicare supplement plan during an IEP, the month you turn 65, and for 6 months after that, so what month are we in? September, right? So if you turn 65 in September, October, November, December, January, up to the 1st of February, you can get a Medigap plan, no health questions asked. No health questions asked. So whenever you are in your IEP, then you're going to choose, I want a Medicare Advantage or a Medicare supplement. And again, for those first 6 months, from the month you turn 65 and 6 months after that, you will be able to get a Medicare supplement plan, and you won't be rated on your health. Zip code is what determines those premiums. So when does your IEP begin? Or it begins when you turn 65, but when can you start your enrollment with Medicare? That's the question. You can start 3 months before the 65th birthday. So your enrollment with Medicare, you can start the process 3 months before, the month of, and 3 months afterward. Now, your Medicare will not be eligible for you to start it until the month you turn 65. So let's use September. If you turn 65 this month in September, it doesn't matter what day you turn 65. There is one loop, but I'll tell you that in a minute. No matter what day you turn 65, let's say you turn 65 this month, let's go backward 3 months. So we have August, July, and June. So if you turn 65 in September, June, July, and August, you can start your Medicare application. Your Medicare begins on September 1st, but let's say you forgot. It happens. Or you just wanted to wait to keep looking at your options. You're doing some research, or you're traveling, whatever. Then you still have, you're not dead in the water, okay? September, you still have October, November, and December. Now, the later you wait, if you wait in the 3 months after the birthday, if you wait, then what happens is your Medicare may not begin for a couple months after that, because you have to wait for them to process and all that. So you may not get your card right away, but your effective date will still be this September, okay? So what if your birthday is on September 1st? Now, anybody who has a birthday on the first day of the month that they turn 65, so let me say that again. Anyone who has a birthday on the first of the month they turn 65, they get an extra month to start that enrollment. So if you turn 65 on September 1st, then instead of June, you'd actually be able to start your enrollment in May. You get an extra bump going forward, but you don't get an extra bump going backward. And it doesn't take off one on the end either. So for those that have a first day of the month birthday, call us. It's just easier to explain whenever you talk to us by phone. Okay, so that's your 7-month window. It's a 7-month period to enroll in Medicare A and B when you are turning 65 or you become eligible because of a disability. And again, whenever that IEP hits, you have that month you turn 65 and 6 months later to get that guaranteed issue plan with the Medicare supplement. With the Medicare Advantage plan, you don't have qualifying questions. Right, for this year, we do have end-stage renal disease question, but that's going to go away very shortly. So we don't want to focus on that, but there are no health qualifiers to be eligible for Medicare. I know we had someone ask us in another question if they would be eligible for Medicare due to some of their health complications. There are no kickouts when it comes to Medicare. When it comes to Medicare Advantage, you just have to live in their service area and you have to have Medicare A and B. When you're turning 65 for those 6 months for Medicare supplement, again, your qualification is you just need to turn 65 and be eligible for A and B. After the 6 months, going into the 7th month, there will be health questions. Why is it important for you to know the initial enrollment period? Because with Medicare, if you don't enroll in Medicare Part B or Part D for drugs when you're first eligible and you do it later on, there will be a penalty. And the thing is, a penalty is not a fine. Like a fine you pay one time, you're done. A penalty is something that you will pay on every month that you continue to have Medicare coverage. So if you delay your Part B, it's 10% of the current premium. For every 12-month period you didn't have it. So if you waited to enroll in Medicare until you were 66, now if you had creditable group coverage, you're clean. But if you delayed it for a year because you just put it off, then when you turn 66, you'll have that late enrollment penalty because it was 1 full year. All right? So you don't want that to happen. And for prescription drugs, it's 1% of the current monthly premium. The average premium right now is like $32, $33, somewhere in there. So it'd be 1% of that per month that you didn't have a prescription drug plan. So our goal, and one of our main goals is, well, our mission is to protect your health, protect your wealth, and your well-being. And your wealth, we help protect that by getting you enrolled in the right parts of Medicare before you incur a penalty. So that's why we're so adamant about talking with us. Now, that's the initial opportunity to get your Medicare. Now, when I say a Medicare year, I go from January 1st until December 31st, right? January 1st until December 31st. That's what I call a Medicare year. So when I say that, I'm going to start with the first enrollment opportunity. Let's say you already have Medicare. You already got your IEP taken care of. We're going to start at the beginning and go to the end of the year. If you missed your opportunity to get an original Medicare when you were first eligible, your next time to enroll is called GEP. Say it. GEP. You'll learn with CMS, the Centers of Medicare and Medicaid Services, everything is an acronym. Everything. So GEP is the general election period. The general election period begins January 1st and it ends March 31st. January 1st and it ends March 31st. The GEP period, the general election period, are for those who did not get their Medicare when they were first eligible. They will apply for, now if you have A and you didn't get B, but your group health plan is not ending, that's different. Okay, I'm not talking to you if your group health plan is ending. But let's say that you didn't get your A or B when you were eligible, or you only got A and you said, no, thank you, I don't want Part B. No, I don't have group health. I just don't want to pay for a premium. And then later down the road, you're like, oh, I think I need that. You're going to have to wait till GEP. So between January 1st and March 31st, you're going to enroll in your Medicare. It doesn't take effect until July 1st. So you will do your enrollment between January and February, but your Medicare will not begin until July 1st, which means you have no coverage, technically, for the first 6 months of the year. That's scary. Now, during that time frame, let's say you enrolled into original Medicare between January and March, right? You met that deadline. It begins July 1st. Between April 1st and June 30th, you can enroll in your Medicare Advantage plan, and it will start simultaneously on July 1st with your Medicare. Or you can go ahead and elect that Medicare Supplement plan, and that will begin simultaneously on July 1st. So if you are a GEP enrollee, then you need to go ahead and select that Medicare Health Plan no later than June 30th, and your effective date can be July 1st. Because if you enrolled during GEP, General Election Period, your Medicare won't begin until July 1st. If you don't choose a Medicare Advantage plan, you have to wait until the end of the year to enroll in one, and that won't begin until January. So now you're going to be on original Medicare from July till December. But if you receive your Medicare A and B, you will be able to get your Medicare Supplement plan, get something, and have that in place unless you decide to change your mind down the road. What I'm saying to you is if you have Medicare A and B because of the general election period, because you delayed it or you put off Part B and rejected it and you're going to get it later, not because you have creditable coverage, but for some other reason, you will have no coverage even though you enrolled in the first 3 months of the year. It doesn't start till July. When July comes, have a plan selected by June 30th. Okay? Have a plan selected by June 30th. So that way, because you went all these months without coverage, if anything happened, you have some coverage, more than original Medicare too. Okay? So that's GEP. Also, between January 1st and March 31st, there's another enrollment period. We don't talk much about it, but because we're talking about all the enrollment periods, I'm going to tell you it's called OEP, Open Enrollment Period. What is that? Well, it's not AEP. It's not an opportunity to go in and start finding plans and changing plans. Open enrollment is for those who have a Medicare Advantage plan or a Medicare Advantage prescription drug plan on January 1st, and they decide, I don't want this plan, I'm going to change my mind, I don't want it, I want out, or I want a different one. They have the right to change. Or they can drop that coverage and they can go into back to original Medicare, and they can select a Medicare Supplement plan. And if you do that, of course you need to get a prescription drug plan. So let me repeat that. If on January 1st you are in a Medicare Advantage plan or a Medicare Advantage prescription drug plan, and you're not happy, let's say your doctor dropped their contract or it didn't have the benefit that you were looking for, whatever the case is, if you are in one of those two plans at the beginning of the year, you have the right to drop that plan and get a new Medicare Advantage plan, or you can drop that plan and go into a Medicare Supplement plan and go into a Part D, or you can drop it altogether and just go right into original Medicare and get that prescription drug plan. If you are on original Medicare at the beginning of the year only, you cannot use that as an election period for a health plan. Okay, but let me be real clear about this. If you want a Medicare Supplement plan, or if you have a Medicare Supplement plan, you can make changes throughout the year on that as much as you want. So let me be clear. A Medigap plan, a Medicare Supplement, Medigap, Medisupplement, you can change those plans year-round. But it's the prescription drug plan that's affected by the enrollment period. So if on January 1st you have a Medicare Supplement plan and you found out that one of your prescriptions were not covered in your Medicare Part D plan, you're going to have that Part D plan through the rest of the year. You have to make that change for another election period. So open enrollment is not to change your PDP plan. That's not what that's for. It's for those who are MA or MAPD and they want to make a change. and they want to either go back to original Medicare or just change that plan one time. Now, that election period will end on March 31st, and again, only for those that had an MAPD or MA at the beginning of January 1st. Then we did general election period, we did the OEP, open enrollment period. Let's talk about SEP. SEP is special election period. There's about 30 of those, but you have to qualify to have it. What is it? A special election period are for those who maybe move out of the area, their plan ends their contract with Medicare, Medicare cancels them, they have multiple years of a low star rating, maybe they go from, let's say if you live in one county and you move into a new county, even though your plan in this county is available in the new county, if when you move to that new county, if there's another option, you can change your plan. So SEP is a special election period, or if you leave your group plan, that's a special election period. It allows you to make a change based on a special situation, and there's a lot of them out there. So if you aren't sure, if you have a special election, if you gain extra help for prescription drugs, if you lose your eligibility for extra help for prescription drugs, or qualified Medicare benefits, if you qualify to get your Part B paid for through a federal opportunity, that is a special election period. If you are in like a special needs plan, we have some of those for people who have chronic disease like COPD or congestive heart failure, diabetics, depending on your service area, because that's a big deal, then you may have an SEP where you can make a change to your plan once a quarter. And again, that depends on your area and the plan you're in, but based on certain things, you may qualify for a special election. And so you always want to be sure if there's a big change, call and speak with one of us, because we may have a window to make a change to your health plan that's going to enhance the benefits you're already getting. Especially when it comes to prescription drugs. If you've gotten diagnosed with a new chronic disorder or disease and you have a chronic disease plan in your area, you're going to want to get that, because it's going to give you opportunity for, again, enhanced medications, maybe certain things paid for that weren't paid for in another plan. And then, like I said, especially going from county to county. If you're in one particular health plan, ABC company, and you move to a new county, even though ABC company is available in that county, if now XYZ is here and it wasn't over there, you have an opportunity to change the plan if it's necessary. And that's another thing. When you call to speak with one of our licensed sales agents, one of our Medicare coaches, they're going to do a needs analysis to determine if it's a good idea to change, because it's not always. But that's what the SEP is. And there's another one, natural disasters. If there's a natural disaster that prevents somebody from being able to take an opportunity of an enrollment period, CMS will determine those. We don't determine that. Medicare lets us know, and then there's a certain way to handle those things. So SEP is a special election period. There's like 30 different qualifiers, and so we want to, guys, we understand it, and this is sad to bring up, but it's true. When you have a couple, a married couple, and you're both on Medicare and you're both on Social Security, right? When one of you passes, Social Security passes with it. Okay, Social Security passes with that spouse. So the surviving spouse will get the higher of the two payments. They will get the higher of the two payments, but when one person dies, Social Security dies with that individual. So when there's a big change inside of your monthly income, there's a lot of things you can qualify for to help with the cost of medications, the cost of co-pays, the cost of your premiums. So if you ever have a life change like that, then you need to call and let us know, because we will help you with that. And again, that opens up an SCP that gives you a new election period. Now, that brings us into the season we're approaching. And what's it called? AEP, the annual election period. Now, the annual election period with Medicare Advantage and Medicare Part D, it's very exclusive to those two parts of Medicare. Medicare Part C, which is Medicare Advantage prescription drug, and prescription drug plans. I'm talking to those members that are in those plans. AEP is the one time a year, and it runs from October 1st to December 7th, but enrollment begins October 15th until December 7th. What does this mean? That means that if you are in a Medicare Advantage, or if you're in original Medicare, or if you're in a Medicare supplement, doesn't matter, whatever you are on or in, this is your opportunity to look around and compare all the plans in your zip code. And you can say, you know what, I like that plan. Hey, they're offering, acupuncture, they're offering transportation, they have a Fitbit, I don't know, whatever it is. They're going to offer a benefit that's going to appeal to you, and if the copays are good, the benefits are good, you like the network that they're using, there are PPO options, of course, in most zip codes, not all of them, but they're out there, and you want to make that change, you can make it. Now, let's say if you made a change on October 15th, or you enrolled in a plan on October 15th, that plan is not effective until January 1st. So from October 15th, if you enroll for the AEP season, it will not begin until January 1st. Why? Well, during the annual election period, that's because people can choose multiple plans. Now, that doesn't mean you get multiple plans on January 1st. It just means that maybe this month or this week you looked at this plan and it sounded good and you enrolled, and then someone else said, hey, come with me to this, I have someone coming over, or someone's going to call me and they're going to talk to me about the benefits of this plan, and I think you might be interested. I know that our doctor takes it. So you hear the benefits, you're like, hey, this sounds good, and you say, I'm going to enroll in that plan. You can. You can enroll in that plan, and the other plan will be trashed by Medicare, and then the new plan you enrolled in will be the new plan. But let's say on December 7th at 11 p.m. you saw a commercial and you're like, oh, that's the plan I was thinking about all along. Oh, I forgot its name. I want that plan. You call into us. We're going to enroll you, okay, at 11 p.m. on December 7th, and that's the plan that will be effective on January 1st. So during the annual election period, you can change to any Medicare Advantage plan you want, any Medicare Advantage prescription drug plan, or any drug plan. And I encourage you, if you're on a Medicare supplement and you have a drug plan, that you compare those ANOCs, you look at your formulary real carefully, because a lot of changes happen with the prescription drug plans. You can make as many changes as you want during October 15th and December 7th up until midnight, okay? Your time zone. But the last enrollment you submit is the one that sticks, right? But we already talked about open enrollment. Let's say January 1st, that plan ends up kind of not working out for you. You get that opportunity to change, okay? Now, the annual election period. What if you're turning 65 during the annual election period? You are not going to use AEP as your enrollment period. You're going to use your initial election period because you're initially welcome to Medicare. So you're going to use that initial election period. Why? Because you're brand new to Medicare, and you want to take advantage of having that open window, that 6-month window for your guaranteed issue of a Medicare supplement, okay? There is one more enrollment period. Do not get it confused with the Medicare Advantage open enrollment from January to March. So let me say this again. From January 1st to March 31st, remember we had the Medicare Advantage open enrollment period. Don't confuse that with this one, so put a line here. When you turn 65, again, with the Medicare supplement plan, those first 6 months, right? Let's box in those first 6 months. You have open enrollment to Medicare supplements, and again, that premium will only be based on the fact that you're turning 65 or that you're new to Medicare. It's not going to ask you any health questions at all on a Medicare supplement. That is also referred to as open enrollment. It's for Medicare supplements, and that's from the month you turn 65 and 6 months thereafter. That's a Medicare supplement open enrollment period. So the Medicare enrollment periods. IEP, initial election period, is the first time you're going to join Medicare. GEP, the general election period, from January to March. For those who forgot to enroll or they declined Part B but they need it now, coverage begins July 1st. You need to elect a plan by June 30th if you want them to start on July 1st simultaneously with your Medicare. Medicare Advantage open enrollment, January 1st to March 31st, you get to make one change to your Medicare Advantage plan or drop it and revert to original Medicare. Special election period, multiple times, different times of the year, it doesn't matter, you just have to qualify for the special election. Like I said, there's around 30 of them. Just call if a big change happens. Annual election period, from October 1st to December 7th, and enrollment begins October 15th to December 7th, and plans begin January 1st, and that's whenever you get to make major changes, which that's the enrollment period we're going into. And when you first turn 65, with Medicare supplement plans, you have open enrollment for the first 6 months, where you can enroll in a Medicare supplement plan, no health questions asked. If you are turning 65 and you decide you want a Medigap plan, make sure you find out which ones have a household discount. Your spouse or other person in some of the carriers, if you have a person who's a senior living in the same house with you, even though they're not in that plan, you can get a discount. So call and speak to us, because those discounts are nice. And so I hope that this made some clarification. And if you have any questions, we always ask that you send us a message, you call us, email us, put your post up here. We're going to answer you. And again, thanks for tuning in, because you know what? We simply speak Medicare, and we love what we do. We do it for you. Your Medicare matters because you do. We'll see you on the next video.